Hello, my name is Jamie McClelland. My student ID is 367439. Today's date is October 21st, 2020, and for you today I will be doing an Nf3 skill of administering medication through an IV piggyback. Before we get started, I'll show you my surroundings. This is my desk with what we need for the assessment, blank board, my IV bag here, and it's an office, so yes, it's kind of messy, but our area is clean and there's the floor. So I'll just read the scenario first and then we'll go from there. So Allison Schnook is a patient who has been admitted with urothelial carcinoma requiring chemotherapy and pain management. The time is 1500 and Allison is due to receive an antiemetic 6 hours after her first scheduled chemotherapy. There's my signature and my student ID number, okay? So before we get started, I'll use hand hygiene. Always good to do that, especially with COVID. Want to get in all the nooks and crannies and make sure that it's dry. So we have the doctor's orders here. And we just want to go through it. So we have Allison Schnook, who was admitted today, October 21st, 2020, and she's age 59, and she's here for chemotherapy and symptom management. Looks like she's starting a lot of medications today, but my medication I'm giving for the assessment is at 1500. So we'll check the MAR for the medication at 1500, which is dexamethasone, 4 milligrams IV piggyback every 6 hours after chemotherapy on October 21st, 2020. And so we have here, it's not signed for, so that's for me to give there. And then we just want to make sure it's also on the doctor's orders. So on the doctor's orders at the bottom here, we have a dexamethasone, 4 milligrams IV piggyback every 6 hours after chemotherapy. Perfect. So now that I know we can give it, we just want to check the drug monograph and make sure that it's okay to give that way. So we have dexamethasone. That's the drug we have here. Perfect. I just printed off this one page of the monograph. We can give it through intermittent infusion. Perfect. It says antiemetic, 8 to 20 milligrams before chemo, and then 4 milligrams every 6 hours. That's what we're giving, so it's safe to give. We can give it through IV infusion, 50 to 100 milliliter mini bag, which is the piggyback mini bag we're going to use will be 50 milliliters, and the dilution for it could be dilutin D5W, NS, normal saline, dextrose/saline combination, or lactate ringer solution. Perfect. So now that we know we can give the drug and we know that we're supposed to give the drug, we can also go through our supplies. So we have a blunt fill needle tip, which we'll need to take out the medication. For assessment purposes, we're going to say they're dry and intact here. And this is a 3 milliliter syringe, which we'll need to drop the medication, dry and intact. Dry and intact, not exactly, but we'll say it is for assessment purposes and not expired. And this is the secondary line. We also have the medication here, dexamethasone. We have the solution here for 0.9% sodium chloride, 50 milliliters mini bag. We have second line labels, medication labels, alcohol swabs. I think I said hand sanitizer. And we also have a sharps container here. So we have all we need. Pen, tape, good to go. So now that we've made sure that we can give this all, we want to compare and do our medication check on the sodium chloride. So we want to say we have 0.9% sodium chloride, safe to give, 50 milliliters, safe to give. We can give it through through IV piggyback, perfect. And it's not expired. It's expired November 30th, 2020, so that's good. Then we want to do a second check. So we have 0.9% sodium chloride. We have 50 milliliters. We can give it through IV piggyback and it is not expired. Okay. Again, we have 0.9% sodium chloride. We have 50 milliliter bag here, mini bag. We can give it through IV piggyback and it is not expired. Expires November 30th, 2020. So now that we've done the check on this bag, we know it's safe to give. And we also actually just want to make sure that the medications Allison is on and the medication we're giving in particular, dexamethasone, is compatible with normal saline. It said on here it is, but we're going to do a double check and check all the other medications as well. Okay, so we have the compatibility chart, and I'm going to take her doctor's orders because we have all the medication she's on in there. And so we have ampicillin, and we have ampicillin here. It is compatible with 0.9% sodium chloride. Then we have dexamethasone, our medication, and dexamethasone, good thing this is in order. Methasone is compatible with 0.9% sodium chloride. Then we have furosemide. Excuse me. Okay, and it is compatible with 0.9% sodium chloride. We have ketorolac, also compatible here. We have metoclopramide. Okay, also compatible here. And pantoprazole, also compatible with 0.9% sodium chloride. And ranitidine. Don't know if I pronounced that correct, but it is also compatible. So now that we know that all our medications that Allison is on are compatible with normal saline, we're safe to give that, which is good, reassuring, of course. And the first thing we're going to do is drop the medication. So we have the doctor's orders here, we have the MAR. We want to drop the medication using the 7 rights of medication. Usually this would have a cap on it, so you want to make sure it has a cap on, and then you want to go through the 7 rights. So this is ward stock medication, so it doesn't have her name on it, but we're going to give it from the MAR here to Allison Chinook. Okay, where the drug is dexamethasone. We're going to give 4 milligrams of it every 6 hours. And we're going to give this today. I'm going to give it at 1500 on October 21st, 2020. It is okay to give through IM or IV, and we're giving it through IV piggyback. And we're giving it to Allison for nausea and vomiting. And also it is not expired. So it hasn't expired. The expiry date here is October 2030. So on both of these, that all matched. So that's our first check for the medication, okay? And so we're going to swab this for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And like I said, this would usually come with a cap on it. And even if it had the cap, you still want to swab for the 30 seconds, okay? Okay. Just so you know, the med math for here, what I did was we want 4 milligrams to give to Allison, and this is 4 milligrams per milliliter. So what we'll have to do is insert a milliliter or a bit more of air and eject also over a milliliter so that we can prime the needle, etc. for Allison's medication, but it will be 1 milliliter that we are giving to her. Okay, so we want to take this syringe, and like I said, dry and intact, but because we've used them before, they're not. So I have this, and we want to keep the end here sterile, and we're just letting this dry in the meantime. So it needs to be dry on the top there, and we want to keep the blunt fill needle also sterile. We just want to turn it on, and then there we have it. So you want to loosen the syringe here. So we have it loose, and now we can drop our medication, okay? So we want to, like I said, insert air into the vial here so that we're able to withdraw medication. So we're going to insert air here. And then we're going to drop the medication. We need 1 milliliter, so we're just going to drop a little bit more than that so we can get bubbles out, etc. Okay, so we have this, and just over here, sorry, I'll move this. We just want to get rid of the excess medication here. So you don't want it to drip back down the needle. So you just want to make sure it's going straight in. There we go. Until we have 1 milliliter here, which we do now. Perfect. So now that we have that, we want to make sure there's no bubbles in it. Perfect, no bubbles there. And we want to recap safely. So we want to recap using the sharps container here so that we don't get any pokes. Okay, so now that we have this, we have it capped, we want to do our second medication check. So we have the vial here, we have the syringe here, and we also have the MAR here. So we have a wart stock medication, but it's for Allison Chinook. We have dexamethasone. We're going to give her 1 milliliter, which equals 4 milligrams. The expiry of the medication was October 2030. We're going to give the medication through an IV piggyback, and we're going to give the medication at 1500 hours, 4 milligrams IV piggyback after her chemotherapy, and we're giving it for nausea and vomiting symptoms, okay? So that's our second check. Now, we've done all our 3 checks on the 0.9% sodium chloride, and we're going to inject the medication into the IV piggyback. First, what we want to do is swab again to always keep everything sterile. And we want to swab the port here for 30 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So once that's clean, we can take the syringe off, and we want to inject the medication into the port here. Okay, come on. Okay. And now we're just going to inject our 1 milliliter of dexamethasone into the IV piggyback here and discard of the syringe and needle in the sharps container. So now we have our medication in here, and we need to make a medication label, which will be our third check. I still have the vial here, and by the way, when you open this, the expiry will change. So we're going to do the label, and we have the MAR and the vial and the MAR and our bag here. So what we want to do is fill this out. So we have dexamethasone, 4 milligrams, IV piggyback every 6 hours at 1500 on October 21st, 2020 is what we gave, and dilute is 0.9% sodium chloride, and the patient's name is A. Chinook, and my name is J. McClelland. So there's the label we have to put on our normal or our 0.9% sodium chloride here. So we have it labeled here, perfect. And then we also need to make a line label, which we may as well make here. For when we go into the room, we need to label our second line. So our secondary line, it says month, October, let's do 21st, time is 1500 hours, initial JM, secondary line, and it is 0.9% sodium chloride with 4 milligrams dexamethasone. So there's our line label there that we're going to bring in with us. And what we want to bring in is the MAR, we have the doctor's orders, we have the line label, we have the secondary label, and I have some swabs as well in my pocket. And so we're just going to enter the room. I'm just going to move this over here. And so we're going to enter. Knock, knock, knock. Hi, Allison. Good afternoon. My name is Jamie McClelland. I'll be your nurse today. What I'm here today to do is actually just infuse your dexamethasone through an IV piggyback. I understand that you had this 6 hours ago, and how are you feeling after it? It's to help with the nausea and vomiting. Did you find it helped? Yeah? Okay, perfect. So we're going to give you another dose of it now as well, but before we do that, I just want to make sure the brakes are on the bed, and then we have privacy as well here. And also, I just need to ask you a few questions before we get started as well. Make sure we have the right gal here. So can you spell your last name for me, Allison? Chinook, C-H-I-N-O-O-K. Perfect, thank you. And could you tell me your birth date as well? December 11th, 1960. Okay, perfect. That's what I have here as well. And we're just going to do your ID as well because it is medication. We should definitely make sure it's the right person. So we have 614973042. Perfect. Before I get started, I'll use some more hand sanitizer. I noticed I touched my face, which wasn't right. And I just want to ask you also if you have any allergies. It says no known allergies, but maybe you have allergies to food or medications or anything like that. None? Okay, perfect. Before we get started, I just want to make sure that we have what the doctor ordered here. So we have normal saline, continuous 10 milliliters per hour. This was hung at 0800, so it is on today's date, October 21st, 2020. So it is valid and not expired. We have a primary line, normal saline, perfect. And so that's all good. We have no air bubbles or kinks that I can see in here as well. So it seems to be running good. And then we just want to put our IV piggyback on. So, Allison, before I get started, can you tell me if at the site you've had any kind of signs of infection? What we're looking for is arrhythmia, which is redness, edema, which is swelling, any kind of pus or itchiness or anything like that. No? And no pain at the site at all as well? Okay, perfect. So we'll go ahead and we'll hang this bag for you. And so what we want to do is take the bag out. We'll put this beside. And so we have the second line here, and what we want to keep sterile are these two ends, which do have clips on them. So I have the IV piggyback here, and what we want to do is first we can attach this to the lock here. And so the port here, we want to sanitize it, or sterilize, I should say, another 30 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And so we can take the cap off our secondary line here. We want to make sure that stays sterile as well. Okay, and we just want to insert and twist here. Perfect. And for right now, we'll turn the roller lock on. And then this port is also sterile as well. So this is also sterile, and we just want to remove the blue cap here. And then we're going to keep everything here sterile. And we just want to pick the IV bag and make sure it's on there secure without touching anything to make it unsterile. Sometimes you really got to twist them on there. Perfect. And now what we can do is we can open the lock, and we can see here that it is dripping here, okay? So we do have production from the bag. And now, because it is an IV piggyback, we want to make sure that we hang it higher than we hang the continuous solution, okay? So we're gonna put this on a lower and this on the higher here. And I do need to use the label here also to line my second line here, and we just want to do it under right here. Oh. Oh, it's a little sticky here. There we go. And we just want to stick this here. Okay, so this says secondary line, and that we hung it today, and we want to make sure there's no kinks and that it's dripping. Okay, so once we've done those, we can sign the MAR here for the medication given at 1500 by Jamie McClellan, that's me. And before we leave the room, I just want to give some teachings to Allison as well. So Allison, I know you had this medication earlier, and I know the nurse then might have went over some teachings with you, and I'm just going to reiterate those, okay? So if you are feeling any nausea or vomiting kind of symptoms, this is supposed to help. So let us know if you are feeling like that, because there might be an issue kind of with the line here. In regards to the line, we also want to make sure that there are drips coming from here as well as here. And we want to make sure that the lines aren't kinked or that there's no bubbles in them. So if you can kind of keep an eye on that if you're moving or, you know, doing kind of your daily things, we just want to keep the lines not kinked and with no air bubbles in them. And then as for that that site, we want to look for signs of infection. Like I said earlier, there was, we want to make sure there's no edema, which is swelling, ecchymosis, which is bruising, and arrhythmia, which is redness, and itching and stuff like that. So if you see any signs or feel any of those kind of symptoms, just ring your buzzer here, okay? This is your call button for us, and I'm going to leave it with you, okay? Okay, before I leave the room, I'll do some hand hygiene, and then I'll just say thank you, and thank you for letting me set this up for you, and let us know if you need anything.